Welcome to this module on the new concept from PEP for the Therapeutic Alliance for Improved Health. The target audience for this training module is both health professionals and communities. The information contained in this module is designed for those providing HIV care, physicians, nurses, pharmacists and community health care workers, and for communities of people living with and affected by HIV. Webinars and workshops, where possible, may include a mixed audience of clinic staff and community members. Key objective of this module is to introduce the new concept of the Therapeutic Alliance for Improved Health. After completing this module, you will be able to describe what is meant by the Therapeutic Alliance for Improved Health, list the 3 key components of the Therapeutic Alliance, and explain what is meant by client activation. In Year 4 of our Fast Track Cities project, we are focusing on 21 Colombian pesos priorities. These include health systems resilience to mitigate, adapt to and recover from disruptions in HIV services, integrated people-centered HIV services, community engagement, and the new concept of community agency, or activation, which is the ability of people living with HIV to choose and act in the context of their health. Also, a new concept is the Therapeutic Alliance for Improved Health, which is the professional relationship between providers and recipients of care in the healthcare system. So, what is the Therapeutic Alliance for Improved Health? The Therapeutic Alliance for Improved Health originated in the field of psychotherapy, and the concept was first described by Sigmund Freud in 1912. 21 Colombian pesos recognizes that recipients of care are critical partners with healthcare providers in ensuring their own treatment success. The Therapeutic Alliance is the vital partnership between recipients of care, healthcare providers, and the healthcare system, which is aimed at ensuring continuity of care and no treatment interruptions. 3 components of the Therapeutic Alliance have been described. First, the agreement on goals of treatment and the concept of collaborative goal setting between clients and providers. Second, agreement on the pathway to achieving those goals and the shared decision making that defines the path. Third, recognizing the importance of a trusted therapeutic relationship between care providers and clients, therapeutic relationship between care providers and clients. Goal setting serves a fundamental role in guiding rehabilitation so that a specific outcome is reached. Setting smart, specific, measurable, attainable, relevant and time-limited goals is a useful way to ensure goals are successful. The agreement of goals between the client and the provider increases adherence to those goals, which in turn leads to improved outcomes. It improves patient satisfaction as well as motivation. All of these factors positively influence the Therapeutic Alliance. When clients are excluded from this process and goals are simply set for them, it creates a situation of dissatisfaction which will negatively influence the Therapeutic Alliance. A key goal for people living with HIV is U=U, meaning that an undetectable viral load means that HIV cannot be transmitted sexually. Take a moment to watch this short video about goal setting. Shared decisions help to strengthen the Therapeutic Alliance. Shared decision-making is a process of providing a client with information and supporting them through the decision-making process. Decision-making and decision support can be considered a 3-step process. Choice talk involves offering a choice, justifying the choice while considering preferences and checking reaction. Option talk involves listing options, describing options, exploring preferences, and examining harms and benefits. Finally, decision talk revisits preferences and moves to making a decision. So, to recap, the Therapeutic Alliance refers to the professional bond between the client and the provider. Key to the Therapeutic Alliance are communication skills with active listening, friendliness, encouragement, and friendly nonverbal communication. Also, key are the practical skills with the ability to provide education that is simple and clear, and skills that reflect provider expertise and training. The Therapeutic Alliance fosters patient-centered care with individualized treatments where needed and taking clients' opinions and preferences into consideration. Organizational and environmental factors are an important component of the Therapeutic Alliance, aimed at retaining clients in care and avoiding loss to follow-up. These include flexibility with appointments and care, visits spacing ideally every 6 months as recommended by WHO, multi-month dispensing also ideally every 6 months, and other aspects of differentiated service delivery including community-based care. Another key component over therapeutic alliance is client agency, which PEPFAR defines as the ability of people to choose and act within the therapeutic relationship and jointly set achievable goals such as achieving and maintaining viral suppression. DSD models represent an important response to barriers threatening the therapeutic alliance as it aims to address the diverse needs of clients. The move to more universal access to DSD models has been accelerated in response to COVID-19 and should continue. Access to convenient, client-centered, confidentiality care is a critical element of the therapeutic alliance. In contrast, mistrust of the healthcare system or healthcare providers, and stigma and discrimination are threats to the therapeutic alliance. Adolescents and youth historically have encountered difficulties with continuity of care and may have frequent disruptions in care, and adolescents may require specific interventions to ensure a positive therapeutic alliance is initiated at the time they initiate care. Some barriers to adolescents accessing health services include consent requirements, unwelcoming environments, judgmental providers, financial barriers, low health literacy, lack of confidentiality, lack of involvement in the decisions that affect their lives, and limited adolescent competency and skills of care providers. Adolescents have the capacity to identify approaches or solutions that will best accommodate their personal circumstances or needs. When supported to make decisions about their own health care, adolescents are encouraged to remain engaged in care, taking more responsibility for self-management and facilitating the transition to adulthood. Involving adolescents in meaningful ways can transform their ability to live positively. Participation can foster their hope for the future, their sense of belonging, confidence and self-esteem, knowledge and skills, opportunities for future employment, and, ultimately, their health. Defines the readiness and willingness to take on the role of managing one's own health and healthcare. Emerged as an important contributor to management of chronic conditions, including HIV. Patient activation is a key concept in the push for patient-centered care. The Patient Activation Measure, PAM, is a scale for determining patient engagement in healthcare. PAM describes 4 levels engagement in healthcare decision-making. These are the 4 levels engagement in healthcare decision-making as described by the Patient Activation Measure. Level 1, my doctors and nurses are in charge of my. Level 2, I could be doing more for my own health. Level 3, I'm part of my healthcare team, and Level 4, I'm my own health advocate. Taking an active role in my own healthcare is the most important factor in determining my health. I know what each of my prescribed medications do. I am confident that I can take my art on time each day at home. I know what my viral load is. I know the importance of not missing schedules, clinic consultations, lab, drug pickups. I know how to prevent further problems with my health. I am confident I can tell my healthcare provider concerns I have even when he or she does not. As